Good afternoon to you viewers of Green Monday TV. We are glad once again to be here to share with you a little bit about health. I am Flavia Chomkama from Action Group for Health, Human Rights and HIV. We are based in Kagoma, Maganjo, Nabweru Sub-County. We thank Green Monday TV and the producers who have allowed us and the directors who have allowed us to come and be on this show, Green Monday TV, every 6 to 7 p.m. without remorse, but allowing us to continually talk to you, our communities. Also, would like to introduce you this particular Green Monday TV show has born for AGA, a YouTube. So today I would like to be speaking in English for purposes of having both reach from the community that we are reaching, but also reach for our YouTube users. We will continue to acknowledge Green Monday TV in whatever we are putting on the YouTube because it has been born as a result of the Green Monday shows that we do on a weekly basis. We thank you for viewing us, and we also would like you to come to our YouTube page, like it. We call upon you, all our viewers, to go to YouTube page AGA.org, AGA.org, so that you are able to watch these shows and see the repeat. Sometimes you could have missed a show, you'll find it there. We thank you so much for always tuning in Green Monday TV, and we look forward to sharing with you today once again. The Women's Month, which was last month, March, ended. We talked about menopause, we talked about taking care of our health, we talked about things that disturb us as women and what needs to be done to ensure we avoid diseases of aging that come around with menopause. So this month is the month that holds the World Health Day, International Health Day, which happens every 7th of April. And this year, the theme for the World Health Day is My Health, My Right. So what do we mean here? Yes, that we should be healthy, and it is a right that we should be healthy. However, on the contrary is that we have failed to take the right to health as a personal responsibility. Many times you meet people and they are blaming health workers, you are blaming your relatives, you are blaming so and so about your health. So if we are going to talk about your health, or my health, my right, what does that mean? It means that the onus of being healthy lies solely on the person, me, that I am responsible to take care, to prevent disease, and ensure that I'm well, I'm healthy. And healthy doesn't mean just not the absence of disease, but emotionally, mentally, psychologically, physically, I am well. So it's important that we start thinking in that line, that as an individual person, how do we ensure that we remain healthy? We have a habit as Africans, and many of us, we only go to the hospital when we are sick. And when you come when you are very sick many times, it takes you lots of money, and also makes it difficult sometimes for the doctors to manage your cases. The doctors who are in the neighborhood, the doctors who are near the health workers who are at the health center 1 and 2, they are not able to manage. So you are forced to even spend more by being referred to higher hospitals or health center 4, 3 and 4, and also sometimes you are forced to go to a private clinic or a private hospital, which are even much more expensive. So I think we need to continuously remind ourselves that health, this body has no spare parts, that we need to continually oil the engine of this body. And oiling means we are looking at the fundamental facets of staying healthy. The first thing is to listen to your body. Let's listen to our bodies. What does it say? Are you having headache, that you are giving headaches all the time? Are you having a pain in the womb and you are saying, it will go? Are you having a lump in the breast that you have not checked? And the lump in the breast is for both male and female. So, what have you done to ensure that you are healthy? So when you have this headache and you push it tomorrow, headache is a symptom. A lump is a symptom. pain in the stomach is a symptom. You need, or we need to continuously follow. Even a minor headache can be the source of malaria, a very strong bout of malaria. Because if you leave it unchecked, the malaria grows, multiplies, the malaria parasite grows, multiplies, and the next day you go, you are on drip, you are on oxygen. I think we need to start looking. Even a small wound can be the source, a beginning of a cancer. So the earlier, that small wound that is not aching, you need to take it to the hospital. Make sure you be sure that this wound that has stayed for a week or 2 weeks and it's not healing, go to the hospital and they find out. They remove some of the cells, can do culture, they can do biopsy, depending on where you go and your history. Once they do that, you are able to detect whatever ailment is there in your body in time. But COVID has also taught us that we can actually prevent many diseases, especially the contagious diseases. The diseases that come out of the air, the diseases that come out of hand-to-hand close contact. We know that during COVID, it was mandatory to put on a mask. We know that during COVID, we were forced and mandatory. We had to wash with soap. And I imagine if we went to the health facilities, there was a reduction in diarrhea, there was a reduction in other cough, there was a reduction in contagious diseases. Because the first point of health care is that tap or water jerrycan you have from the toilet, or when you reach home from wherever you are, you wash your hands and you don't touch anything before you have cleaned your hands. I have a very bad habit. When I reach home, my first direction is the bathroom. I wash my hands, and oftentimes I also wash my face. I don't know why I wash my face, but mainly when I go to the bathroom after work, the first thing I do is to wash my hands. Because I know at work, on the road, wherever we have been, we have touched very many things. Even our handbags are that dirty, that you need to wash before you eat, you need to wash before you lift someone's child, you need to wash before you touch your eyes, you need to wash, because we know that washing our hands keeps us safe, keeps a reasonable and sizable amount of germs away. But washing also is not just pouring water, it is serious washing, doing it with your hands, checking all the corners of the hands, and the fingers, on top of in the palm, in the back of the palm. Wash very well, because germs hide nails, keeping short nails, or if you keep long nails, ensuring that they are clean. And that's why we are washing. And so we ensure that if you have very long nails and you're not sure they are clean, then use a fork when you are eating. But when you wash, please, when you come back home, wash. When you go to the toilet, wash. Before eating, wash. After eating, wash. When you go to burial, wash. When you go to the hospital, put on a mask. When you come back home, remove the mask, wash, and then you can touch people. Because like now, we have this epidemic of red eyes. We need to seriously, this month, which is My Health, My Right, we must observe the My Health by ensuring that we are washing our hands consistently and ensure that we don't spread the red eyes. They are all over. People have been saying they are home with red eyes. In our neighborhood, the children bring the red eyes for day scholars. They get from others, they bring home. So it's important that we start taking care and remembering the COVID lesson, that we should be washing our hands consistently and ensure that we are clean and we keep sizable amount of bad germs away from our bodies. So it's your health, yes, it is your right, but you have the responsibility of doing that which keeps you safe, keeps you away from the hospital for medicine, but keeping safe and learning information. Listen to the radio. It is your health, yes, but you need to listen to the radio so that you know when the children are being immunized. You know when yellow fever is being immunized against. And we know that this week we are having yellow fever immunization campaign across the country. So it is your health. Guard against getting yellow fever. It can be painful. Diseases can be painful when you have already gotten them. Let us try as much as possible to take our children for immunization. Right now we have rubella or measles flying around. Can we try to be safe, to protect ourselves? And by the way, the measles are not only for us, for the babies. We see that Europe and America have an epidemic of measles. You could imagine that those developed countries, they have immunized and they can no longer get measles. We have had also pockets of polio in Western Uganda. We need to ensure that we make a difference, because those are diseases that were long gone. But now we realize that around immunization, we are failing to take our children for immunization. We have 195,000 zero-dose children, children who have not been taken for immunization, not even for a single. So these ones, when they get like measles, it's only God's luck that they get well. Sometimes they fall really very chronically sick, almost their deathbed. So it's important that we do my health, my right, but also ensure that us as adults, we let the children access the services, the prevention services that are available. We also do understand that there is high prevalence of cervical cancer, and it's the biggest killer of especially those people living with HIV. But we can always prevent cervical cancer by immunizing our girls who are 9 to 14 against cervical cancer. There is what we call the human papilloma virus. We can prevent it into developing into cervical cancer by taking a vaccine. For those children who are 9 to 14, let us take them back. Let them go and look for vaccines. But also I think government has plans oftentimes to go to schools, because this is where the girls and boys are found. So it is important that even when we are thinking about health, we put ourselves in that situation. If you are having headache, constant stress, you are not sleeping enough, your health really, you need at least 6 hours of sleep. But how many of us do that? We are on the phone first thing in the morning, we are on the phone last thing even in the night, which is like 2 a.m. and then by 6 you are back on the phone. It's your health, it is your right to even watch that phone and use that phone. But how much electromagnetic rays are you consuming in your body? And many of us, we have babies, we want to give them phones to touch. These mobile phones, smartphones, they are not simple. They have a lot of electromagnetic rays that you need to keep away from the baby. Let us try to understand that my health, my right is about being responsible for your health, to ensure that you prevent diseases, but also ensure that your neighbors, your family members are protected from disease. So for contagious diseases like HIV, it is your health, it is your right. We assume and we pray that you continuously listen to information. Lots of science and innovations is happening, but we don't have a cure for many of the contagious diseases, viral diseases. So we need, just like you have flu, it comes and goes. COVID came and it is now mild. But things like HIV, which comes through the blood and the body fluids, you must be overly careful. It is your body, it is your health, it is your responsibility. So we need to understand that our health is our responsibility before even it becomes a right. It's a right. We understand it is inherent. You are born with the right to life and right to health. But you must ensure that while the rights are being observed, you also ensure that you take responsibility to seek information, to seek care, to get referral and you follow up the referral, to ensure that when you get that medication, you are taking it on a timely basis, to ensure that if you have an appointment, you go back as you have been appointed, to ensure that you invest in yourself, a kind of plan or health plan that you follow If you are supposed to go for checkup every 1 year, or for the old ones, blood pressure, weight, and blood sugar, you can, I think we can do it regularly, like in 3 months. If you are not very, very old or not feeling sick, you can go and get the checkup on a regular basis, because when you observe these changes in the body early, you are able to manage it at the lower level facilities. And for those who are young, if they say come back after 3 years for cervical cancer screening, checkup and screening, please do so, because it is for your own good. And for those who are found with diseases and they said come, go, please be patient. And I think being patient is that we should understand that sometimes diseases come slowly and go slowly. So let's not go to the hospital to get a magic bullet. Let us also ensure that we start with a lower cadre medication. It is your health, it is your right, but don't start with headaches when you have not used aspirin or Panadol. The higher you go, the medications level and regimen and state, the more side effects these medications have. So you'd be better off getting the lowest recommended treatment from the health facility, and mainly public health facilities. They are very good at diagnosing and also giving you the low cadre, kind of lowest level treatment that you require, that can actually treat you. I know private facilities would love to see any child who comes with a cannula, any one injection, but really, can't we give children to swallow, to take oral kind of treatment? Must we have cannulas all the time? This is money making, of course, but major public hospitals and health facilities that the government has put up have the best diagnosis, and they will always give you the medication that works, because they see very many patients and in your category, and they have seen what works and what doesn't work. So I always encourage, if you are going to take your child or you are going to go for treatment, if you can, go to a public health facility, health center 2, health center 3, 4, government hospital. They do have the capacity to diagnose and also give you the right medication. Where they fail, then they will send you for specialized treatment elsewhere, because maybe they are not furnished well with what is required in the government hospital. Like, you know, we are too many people going to the government facilities, but we know you can even go, they check you, they diagnose you, they even write for you medication if it's not there, and you buy it and you get healed, rather than running to a private clinic where you are going to pay lots of monies and you find yourself paying a lot for something that could have been managed with less. Go to YouTube at AGA YouTube. You listen to this once again if you feel the Holy Spirit has touched you and you would like to listen to it a little bit more. So welcome back. I'm Flavia Chomkama from Action Group for Health, Human Rights and HIV. We are based in Kagoma. We are a health financing advocacy organization. We do community social mobilization and monitoring and accountability. We also do health awareness for critical issues and raise awareness about the key advocacy needs of this country and especially of communities. So like I was talking about this month, we are talking about International World Health Day, which is happening on the 7th of April, and this happens every day, and the government is also planning. And the theme for that day is my health, my right. And I said, yes, it is your health, it is your right, but you need to be cautious about the rights you are talking about, especially if you are not responsible. People come to hospitals very late and they start blaming the health workers. We appreciate the attitude of the health workers. Sometimes it's not good. And because of too many staff, sometimes they are rude or whatever. But I do understand that many of the health workers are actually doing very good work and are able to understand and to listen to the clients. Sometimes we expect medication, but we are not paying taxes. So if you are not paying taxes, you are evading taxes. How do you expect the government to buy medicine? I do know that many of us are saying, pay tax for what? Because we don't see what is going on. Maybe it is high time as communities we take the responsibility to cross-check with the health facilities what is there, what is not there, how much money has been brought to buy how much drugs, how many drugs have been delivered at the health facility, that as communities we need to know and understand how it is delivered. It is our right. It is my health and my right, and therefore it also lies on me that I should be able to know the health policy, the health guideline, the management of the health facility, but also know how these resources are being used. If there is money that has come to the facility, if you take care as a citizen, you go to a health center too, or a VHT, you ask what is there, what has been available, what can we do. For us, we do community mobilization as civil society. So we can also do community monitoring, finding out what is happening in terms of health. Are the health workers working? Are they there? How many are they? If there are only two, is the other one working if another one takes leave? Or if they have a patient, is another one there to represent and be there? So it is important that we take continually understand that health is our right, our health is our right, and that we should take responsibility to monitor the health systems, the health, essential health medication, is it available? And ensure that we are able to reach out to the communities, educate them about the available health facilities, their health rights, but also their health responsibilities. It's important that we continually understand that there is no right without a responsibility. Like I said, if you want to be healthy, you must be also ready to be responsible for your health. You must remember to wash your hands. You must remember that you have to have a clean home. You have to have the right sanitation, wash your hands, put on a mask if you are in places where you are exposed to COVID, flu, TB, and other diseases that come through the air. We also need to understand that as persons, we are responsible for getting knowledge. If you don't know, go to your VHT, go to the peer educator, community health worker in your neighborhood. Ask them. They have some sizable information. And when you are referred, maybe the health worker doesn't have, the VHT doesn't have, the community health worker doesn't have, then when you are referred, go and seek your appointment. If you have been given medication, please take it. Ensure that you take the medication. But also remember that your health should be your nutrition, and your nutrition shall be your health. Ensure that you try to eat as healthy as possible. For instance, mukene, dodo, that popo, that guava that is in your compound, that green that you have, green leafies, that dodo which is near in our compounds, and we are not even bothered to take it. Pumpkins, we are busy running to look for celery, we are busy running to look for spinach. These are introduced, but we have our own local greens. A jobio and sugar, even don't know how they call them in English, but these are local greens that are very healthy and nutritious. And I think I love the people from northern Uganda and eastern Uganda. They have a lot of that green that is slippery. We used to have it in our communities, but it's slowly getting extinct because we think it is slippery and we don't want to take it. But the body requires it. And I think the slippery it is to moderate our temperatures, our blood pressures. There are many plants that God created for us in Uganda that we can take to regulate our health. And by the way, the components, you don't need so much to eat so much to ensure that you get those vitamins, those minerals that you require. Let us consistently try to make sure our health is our nutrition, and our nutrition is our health. Because when you are feeding well, and well, I'm not talking about chips, chicken, and Coke. No, I'm talking about the basics: beans, could be posho, it can be cassava, it can be mukene or silverfish, it can be the common foods. Bitter tomato, eggplant, these are things that are within reach. Cabbage, you have the green, we have the purple. We have all these greens that we have in our markets, or even in our backyard. We can even do in the backyard and we have some greens. It's important that we take our nutrition, very important, to ensure that we are healthy. Not that we need to continuously deworm, because worms also can cause some discomfort in the body. Let us try to deworm ourselves at least every 6 months for the babies, and also even as the old ones. It is important because the foods we eat, the raw foods we eat, you find there are worms and germs. We need to continuously deworm, but how many of us are doing it? We need to continuously be exposed to vitamin D. How many of us sunbathe? I went to a hospital 3 years ago and I was told I was lacking vitamin D when I live astride the equator. So let us consistently look for a moment to be in the sun. Some of us, we come home, we sleep, in the morning we are in the car going to work, reach office, you enter the office, you don't have time for sunshine. Weekends, we don't even have time for ourselves to move out. You are moving in the car, you are moving up, down. Don't have time to even get the sun that has been given us naturally. So it's important that we take care of our health, we take responsibility for our health, and also the other diseases that are common, diseases of congestion. Some of us have houses we never open windows, and sometimes when there's a TB patient or a COVID or flu, then it affects all of you at a go. The dusty house will affect you. Those with asthma, those with have allergies, they will not stop going to hospital. So it's important that we keep clean, ensure we keep the dust away, we keep the windows open, the ventilators. If you are building, please put ventilators onto your house, because it is very, very important that we have ventilators to have fresh air and ensure that our lungs are kept clean. We need to remember that much of the food we are taking they are using chemicals to make sure they grow, because our soil has been eroded. Let's ensure that we wash the greens and the tomatoes very, very clean. If we can have, I've been told that you can use lime in the water to ensure that you significantly remove much of the toxins. Let us try as much as possible. If we can even use organic pesticides. I hear people use rabbit urine to be pesticides for their crops, and this is healthy, it is organic. Can we try to look for food which is organic? Much of the food we are eating is contaminated with chemicals. The maize is sprayed, the beans are sprayed, the nakati is sprayed, the tomatoes are sprayed. I even think the onions are sprayed. So we are taking in a lot of chemicals. But the other thing also is that we are eating on plastics. Hot things and plastics, they cause agents, that chemicals reaction that causes cancerous particles. So why cancerous situations? Why don't we even try to throw away plastics? People are addicted to plastic, but one of the other things that we need to look at is the plastics. Can we try as much as possible to look for maybe metallic, glass, or earthenware for the cups and plates that we want to eat, to use for eating? Cancer is on the rise. We have plastics around us, food in the tea in the morning, lunch, supper on the plastic utensil. We are eating food that is highly poisoned because of the sprays that they have used to grow them. To the extent that even you go to a shop, you go to the market, you find onion or tomatoes still have even that pesticide. Can we avoid that one which already has pesticide? Sometimes they will wash it off. But if you see it directly, don't wait that you reach home. Try as much as possible to buy tomatoes which don't have pesticides on them. Let's try as much as possible to eat healthy. Like maize, we want to eat the white one. That white one is not very healthy. In my house, I eat almost brown, the one we used to eat in the school. And people say that one is bad, it could be chachu or what. It is not, because even hens, they want them to be healthy. They give them that most healthy part of the maize. So if I'm going to get maize flour, I just remove one cover. The rest I grind and eat it whole. That's why they call whole grain. Eat whole grain, even if it is it is millet, it is wheat, it is rye, it is barley. Eat whole grain, don't eat in bits, because what they remove is what is most nutritious. But for us, we want to feel the taste. We want to eat the white, which is plain, which is not healthy. So ladies and gentlemen, thanks for watching us, and thanks for checking on our YouTube page. We believe that you have understood that it is my health, my right. But my right does not go alone, it goes with my responsibility. Probably what we can say is it is my health, my right, with my responsibility to take care of my health. It's important that we continuously observe our health, and we look forward to commemorating International Health Day, which is happening on 7th April 2024. The government is making plans, and I know some districts are, and we thank you, Green Monday TV, for always hosting us. We thank you, Jack and team, Director Hussein, for giving us space, and we look forward to actually meeting face to face to understand this kind of generosity from Green Monday TV. We thank you for watching Green Monday TV, thank you for tuning in AGA YouTube. We look forward to seeing you next week on Green Monday TV. Tovao.